Hi, my name is Whitney and I'm a dental hygienist here to talk about a career in dental hygiene versus a career in nursing. While these careers share some similarities, they also have distinct differences that could sway your decision on which path you end up pursuing. So let's talk. A registered dental hygienist, RDH, and a registered nurse, RN, both require similar science prerequisite courses in school and both involve patient care, both in clinic, in school, and in the workforce. However, the career paths diverge significantly in terms of work environment, career advancement, and specialization options. So first, nurses have diverse opportunities in various settings, right? From hospitals, several different sections of hospitals, the ED, ER, cardiac floors, and NICU, labor and delivery, etc., to schools, to outpatient surgery centers, doctor's offices, to nursing homes, to home health. Lots of options for different workplace settings for nurses. On the other hand, dental hygienists primarily work in dental offices, either private or corporate offices with limited specialization options. I mean, you can work in a periodontal office or in a pediatric office, and it doesn't require any extra schooling or anything like that. It's not unheard of to work at a specialist's office, but even so, these are still normal dental office environments for most dental specialties, right? However, non-traditional dental hygiene clinical jobs are growing. For instance, there are more and more states allowing mobile clinics where you can expand into nursing homes, homeless shelters, prisons, things like that. But overall, at the current moment, there are more robust workplace environments and opportunities for nurses. Both nurses and dental hygienists require strong communication, critical thinking, and attention to detail skills to provide comprehensive patient care. Dental hygienists also need excellent dexterity, manual dexterity for hands-on dental procedures such as scaling teeth. It's helpful to have a strong stomach in both careers as well, since there can be lots of spit, blood, bodily fluids splattering in the air. Both nursing and dental hygiene can have their moments, but if you love it enough, you will easily look past it because you'll be focusing on the task at hand. Like we mentioned at the beginning, both nursing and dental hygiene programs have similar science prerequisite courses. This includes classes like microbiology, chemistry, anatomy, the required courses that you take prior to applying to the nursing or to the hygiene programs themselves. Both nursing and dental hygiene offer 2-year associate degree programs as well as 4-year bachelor's degree programs, depending on your choice of education. And for dental hygienists, the more school you complete generally does not directly correlate with how much money you make. If you're working as a clinical dental hygienist, chairside in the op, the traditional dental hygiene role. But having more schooling and degrees can open more opportunities for you if you want to expand outside of clinical. Like if you want to go into education, teaching, dental research, business, dental marketing, things like that. Whereas with nursing, when you get an advanced degree, such as a Bachelor of Science in Nursing or a Master of Science in Nursing, or if you even go out to become a nurse practitioner, it will often correlate with you having a higher salary within a hospital or whichever location you choose to work. Speaking of the work environment, again, nurses typically will work in diverse settings, like we said, hospitals, schools, nursing homes. And what comes with most hospital settings is long hours and varied shifts. Y'all have heard of nurses working nights, 12-hour shifts, weekends, holidays, things like that, depending on the location of work, of course. Not all nurses need to work holidays, especially if you're not in the hospital setting. But it's something to keep in mind, especially when you're first starting out. Until you get more seniority, you might not have the most flexible schedule as a nurse. Every hospital unit is different. It's just a generalized statement, something to keep in mind. However, nurses often have much better benefits than dental hygienists. So as a nurse, you'll have PTO, paid time off, and healthcare insurance. Seems like every job should have that, but believe it or not, with dental hygiene, sometimes you won't have any PTO or benefits or insurance. This is because in dental hygiene, oftentimes you will need to work at 1 or 2 different part-time offices. Sometimes it's hard to find full-time gigs. Not always, but often. Again, these are generalized statements. Every situation and every job offer is different. It's just something to be aware of. If you're scrolling through job postings and you notice many dental hygiene jobs are looking for part-time workers, I will link my pros versus cons video about the dental hygiene career if you want to dive deeper into the benefits. But for the purpose of this video, just remember that dental hygienists typically work in dental offices, usually enjoying regular hours, 9 to 5, 7 to 3, maybe sometimes working an evening or two during the week, maybe one Saturday a month. It just depends on the office. And it's usually a smaller work environment than most nurses who work in hospitals, right? Unless you happen to work in a large corporate dental office. And lastly, although nurses have better state reciprocity than dental hygienists, like for dental hygiene, if you are moving to work in a different state, it's a whole thing. Some states make you retake your board exams. Not all, but lots do. They are trying to make this better right now, but it's something definitely to be aware of if you plan on moving a lot from state to state. It's much easier to be a traveling nurse than to be a traveling dental hygienist. But I will say, dental hygienists often have more flexibility when it comes to the hours they work, our work schedule. Right? It's much easier to negotiate your schedule in a small dental office since you work with your boss one-on-one every day, as opposed to a large hospital organization. There is usually more room for flexibility when it's a private practice versus a corporate office. Not always, again, but often. Overall, being a hospital employee where there's thousands of nurses, it's very different from working on a dental team with less than 10 people. I can't say it enough. Again, this isn't always the case. Some nurses do work in smaller doctors' offices as well. It is possible to see your boss every day, and for work as a nurse to not be in corporate culture all the time. It's hard to exactly compare nurses versus hygienists, just since there are so many different workplace environment options that make each career very different from the next. In conclusion, whether you choose nursing or if you choose dental hygiene, it all depends on your preferences and your long-term career goals. Both professions offer fulfilling and well-paying careers, but they differ in work environment, advancement opportunities, and specialization options. So if you want to learn even more about the differences, be sure to take time to explore your interests and consider which path aligns best with your aspirations. I will link my nurse versus dental hygienist article in the description box if you'd like to learn more about the differences between the two, as well as my free RDH video checklist. If you are someone who is leaning toward the dental hygiene career, I made this video checklist especially for you because I am a dental hygienist and I get lots of questions in the comments and messages. Everyone's asking me how to become a dental hygienist. Whether you are in high school, college, or even some of you may even be looking for a career change. Maybe you are a nurse and you want to switch over to dental hygiene. Whatever the case, if you're interested in learning everything there is about the RDH career, be sure to click the link below. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com. I will also link the nurses versus dental hygienist article. And you can also hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.